You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Folks, we'll continue to see the impact in this country when it comes to coronavirus. It is deadly, it is serious, and folks who are playing games with this need to understand that you and your family can lose their lives. Joining us right now, Dr. Valerie Montgomery Rice, President and Dean of the Morehouse School of Medicine. Also, Dr. Ebony Hilton, Associate Professor of Anesthesiology and Critical Care Medicine at the University of Virginia. I'll start with you, Dr. Rice. First and foremost, Dr. Fauci and others said this was going to happen. Once we got to the winter, if people did not buckle down, if folks did not pay attention, we were going to see this explosion. We're actually seeing it. What is it going to take for people, especially in these red states, to realize this is real? They're now projecting by the spring, we're going to hit 400 to 500,000 deaths.
So I think what it's going to take, first of all, is for people just to remember the 3 W's, right? Wear your mask, wash your hands, and watch your distance. That's the first thing we can do. And then I think we have to continue pushing the education of what happens to people when they contract this virus so they can see how serious it is. You know, when you look at the data, I don't know anybody who doesn't know someone who's first contacted the virus. And then we know that they have worse outcomes if they're Black or brown. The second thing that needs to happen is that we got to get more testing. We got to make testing more readily available. And then when people are positive, we got to give them the opportunity to isolate, do contact tracing, and then quarantine those persons. That's what we got to do. We got to get that message out there, and we got to get the resources out to people.
One of the things is just dealing with the sheer stupidity of Dr. Ebony Hilton. For instance, here's in Virginia, this crazy right-wing Black pastor, E.W. Jackson. This is what he said in March.
See, folks, I'll tell you something. I'm going to boldly say this. I will not get the coronavirus. I will not get it. Who do you think you are? How can you say that? Because I've asked God to protect me from it. And I've confessed Psalm 91 over my life and over the life of my congregation and over the life of our families, and we're not getting it. In the name of Jesus.
Ebony, that was on March 27th when the folks at Right Wing Watch posted that particular video. This was November 16th.
Well, it's good to see all of you here today. And it's
Amen.
good to be with you today. It's good to see all of you on Facebook Live. I want to say that I've been out for the last several weeks. A couple of weeks I was out because I was speaking somewhere else. And the last week I was out because I was tested positive for COVID-19. So, but I'm back. I'm healthy. I'm sound. I'm whole. Praise God. I'm feeling good. And I'm just grateful to God. And my wife is, of course, she got it from me. One of my little gifts to her. But she's doing fine, too, and she's going to be back to work tomorrow.
That's the kind of stupidity, Ebony. You go on the video, I will not catch it because God protects me, and you got it.
Yes, and unfortunately, it's one of those things that so many people are continuing to deny that this thing is real. But what we know is that over 100,000 people are being tested positive today, and by Inauguration Day, we're expecting it to be 400,000 people diagnosed with COVID-19 every single day. This thing has to be taken seriously because it's costing literally hundreds of thousands of lives at this point.
This is, and where we are, Dr. Rice, we're sitting here, we're hearing the companies down talk about vaccine, where that comes. But before you even get to that, we still have to deal with the folks who don't want to listen. But here's the other thing. I saw us, and maybe you could help us out here. Folks have been posting these stories saying studies are being done saying masks don't work. Then I saw one study that said that mask works for the person who has it, but not for the other people who also wearing it. And I'm sitting there going, okay, where's not all of this coming from? It's muddying the waters for our people who are listening. Are you and Dr. Hilton recommending wear a mask? And if so, what type? And what else should we be doing?
Okay, so it's very simple. 3 W's. Wear your mask, wash your hands, and watch your distance. There have been conflicting information that comes out. I agree with that. But there's no confusion about the benefits of a mask. The mask protects you, particularly if you wear it correctly, over your nose and your mouth. Most of your secretions will come out of your mouth. So therefore, when you wear your mask, you are protecting someone else. Most people acquire the virus through their nasal area. And so when you wear the mask, that decreases the opportunity for their secretions to get through your nasal passage. So there is a dual benefit. You protecting others and you protecting yourself from wearing the mask. There was a study that just came out that looked at, and this was out of Denmark. It was in Denmark where they had half of a group of people wear the mask and a group of people not wear the mask. And what they showed, even though it didn't reach statistical difference, there was clearly a trend of the people who wore their mask having a decreased chance of being infected. Because, again, they were covering their nostril area, which is where the virus gets in. Wear your mask. No discussion.
Ebony, when I traveled for the first time in October, you got a whole bunch of text messages from me because you've also been trying to get people to understand that it's not just covering your nose and your mouth as well, protecting your eyes and your ears.
Right, because it's all connected. And the way that I kind of help people to understand that is when you're crying, you'll notice that your nose gets running, right? Because literally your tear ducts empties into the same cavity as your nose and into the back of your mouth. And so with this idea of a mask, I also want people to understand that when you're seeing people talk, when those little droplets that come out, there's many, many viruses that can stay in that bubble, for lack of a better word, of spit that comes out. And so when you're wearing a mask, instead of someone being able to, and this is going to get really nasty, but I'm just going to say it so people can understand the analogy. If someone were to hawk a spit towards your face, imagine how much virus is contained within that mucus, right? If you have a mask on that can block the large portion of that from going directly into your mouth, you're decreasing the viral load that you're taking in. And hopefully you won't be able to overwhelm your system. So I know oftentimes people say, well, the masks, they don't filter out viruses, right? No, if it's aerosolized, if it's that fine mist, no, it cannot filter out that. But what we're trying to prevent is that large dose of virus being able to enter into your mouth, enter into your nose, enter into your eyes, that can overwhelm your system. And I hope that makes some sort of sense.
Dr. Rice, when we also look at, again, these rates, and there are people right now, look, they miss their families. Look, when I went home in October, that was the first time I had seen my parents since the previous year, since Thanksgiving. But people are saying right now, look, if you want to see your people next Thanksgiving, avoid them this Thanksgiving.
That's right. We really are asking people to be careful and to avoid large gatherings. We love our Thanksgiving. I mean, it's my favorite holiday. My sisters and I, we usually all get together and we're cooking the night before. We're playing bid whist and spades and our kids are here. But this year we have to do something differently. We need to gather with our insular family, our small group. And for some people who are going to travel, I've said tips like this. If you are going to travel, make sure, of course, you have to wear a mask. Eat before you get on the plane so you decrease the chances of taking off your mask. And consider testing. If you cannot get a test and you're coming home like our kids are coming home from school, then I would say to those young people, you need to quarantine for a period of no less than 5 days upstairs in your room, limiting your contact, wearing your mask while you're in the house until we are sure that you are not symptomatic. But if all possible, get a test. There are multiple places where you can get a test. You can get tests with all of the CVS, and there's lots of drive-through groups that are offering testing. And so if possible, get a test. But you definitely need to try your best to avoid large gatherings, because there will be someone in that gathering that is asymptomatic and that most likely will have that virus.
Ebony, I got somebody sitting here on my YouTube channel, Angel. She says, I'm debating whether to go to Indiana from Georgia to be with family. I mean, again, unless you have significant protections, unless you have testing for every single body. And here's the other deal, even with testing. There are people who can test negative today. We saw that with a bunch of these White House folks, that it takes time for COVID-19 to develop and show up in the body. So you can test negative on Wednesday. It don't mean you don't have it.
Well, I mean, again, I always like to give examples because I feel like people can get it. At this point, the White House is the most protected house in America. And they tested everyone. And what did they have? A super spreader event where Trump was infected. We've had, who else was literally the Speaker of the House? We've had so many people, Chris Christie, Herman Cain, that these people are getting tested so they can be close to the president. And yet the president himself came up positive. What people have to realize is that just like a pregnancy test, women, we know that very early on in your pregnancy, you could have taken a pregnancy test and it would have came back negative. It didn't mean that you didn't have a baby growing inside. It just meant that whatever substance we were trying to measure on that test, the amount that you were actually producing in your body was too low to be detected, right? The same thing with this COVID-19 test. You may not be shedding a high enough viral load for it to be detected, but it doesn't mean that you're not infected. And what we know is that if you err wrong right now, every 44 seconds, one person dies in America from COVID-19. So you think about how long this show has been running and count every 44 seconds and say goodbye to someone. And so when you're making that assessment of, is it worth this trip? Think about your family members and recognize the fact that, unfortunately, we're having people taking this into their homes and they're having to say goodbye to their mother, to their father, to their sister, to their brothers. And it's just simply not worth the risk when we can wait and hopefully get to a point of vaccination and herd immunity and other treatment modalities to keep people alive. But right now, people are dying.
Final, Dr. Rice, real quick, y'all are working on a PSA campaign, correct?
Yes. Yes, mask up, and it should hit out sometime this weekend or I think on Wednesday. But the whole point of it is just to encourage people with the 3 W's: wear your mask, watch your distance, wash your hands, and then just encouraging people to stay the distance. We're running a marathon right now. We really are. And we are going to see the finish line. We have 3 vaccines that have been completed with their phase 3 portion of the study, and 2 of them are over 90% effective. 1 of them is over 70% effective. And so there is a finish line that I can see. Now, it's going to take a lot of logistics and a lot of commitment for us to get people to take this vaccine and to get enough people taking it where we see the efficacy of it, see how effective it is, okay? It's one thing for you to build up immunity. It's another thing for the vaccine to be effective. Enough people have to actually get vaccinated. So we still have a long way to go to get to that finish line, but I can see it. And we just need people to hang in there, continue doing the work that they've been doing, washing their hands, wearing their masks, and watching their distance. And then we're asking the government to ensure that we have enough testing available such that when people are positive, they can isolate, and then we can do contact tracing, and we can quarantine people, and also that people don't lose their livelihood while they are quarantining or isolating to get through this period of being active with the virus.
So let me reiterate for everybody who's watching me, those of you who've been asking questions. Ebony, the only way for you to be sure is if you're going somewhere, you quarantine for a specified number of days. Get tested. If after that quarantine period you are not positive, but that has to happen with every single family member. It can't be one person out of 12 who does that. And when I was talking to somebody and they were like, well, hey, but you can still go home. I said, guys, the moment I leave my house, so let's say I quarantine at my house here in the DMV. The moment I leave my house and go to the airport and get on the plane and then fly home to Dallas or Houston and then go through that airport, go through the rental car, I now got to quarantine on that end.
I mean, it's one of those things to give examples, right? When we're talking about your risk of infection, when you're on a plane, you have to remember that people are coming from all different areas of the country to coalesce in Chicago or Atlanta, where we have these major, hubs of these airports. They're bringing whatever risk of virus with them onto this plane. Now, when you're talking about risk, what does that mean? So there's actually, you can type in COVID tracker risk or your estimated risk of exposure, and they can have different calculations for different counties. And to give you an example, like for instance, in Cass County, Illinois, if you have a group gathering of more than 50 people, you're 99% likely to meet at least one person who has COVID-19. If you gather 15 people in this little space, you're 75% likely to find one person who is going to be COVID-19 positive. So that 15 people, that's basically a family unit. So again, if you're bringing people from all over this country, we just have to realize that risk is relative to wherever they're coming from. And if they're in these hotspot areas, like in North Dakota, where we literally have, I think it's 19 counties, that if you had 15 people gathered, you're at least 75% likely to find one person with COVID-19. If they're coming from those areas, they're bringing that risk with them. So you have to take precautions.
And the last point here, Dr. Rice, I remember the news conference where Trump and all these people were up there and they were talking about we're going to see this mass testing taking place in parking lots of Walgreens and CVS's and Walmarts, all the sort of stuff along those lines. And reality is we still haven't seen it because we have not created a mass testing deal. I'm trying to pull a video up right now. I mean, we're seeing these massive cars. These massive cars lining up in D.C. and New York. And in fact, I saw this video here. This was literally video at the Shanghai airport where they announced they're going to be doing this COVID testing, and they're just trying to push some of these people back. This is what happens when you do not have, again, an orderly process. And that's what we're seeing all across the country. Massive lines at the Dodger Stadium and these other stadiums. It's crazy.
You know, one of the things that we have definitely been pushing, we have a COVID-19 collaborative that's been put together by the BlackDoctors.org, the National Medical Association, the 4 Historically Black Medical Schools, and the National Urban League. And you may have seen our love letter to Black America that we released today. And that was really saying to Black America that we see you, we hear you, we love you, we're here, we are concerned about the risk associated with the vaccine, and we're in the room helping to make the decisions about the priority of the vaccine distribution and the trials. But we also are talking about resource-aligned testing strategies. And that's one of the things that we have not seen. And so what I'm hoping is with this new administration, with the Biden-Harris administration, that they are going to, first of all, the Defense Production Act, we are going to produce all of the PPE that our healthcare professionals and frontline workers and essential workers, what they need. Hopefully they're going to do that. And then the second thing is, and these need to be done concurrently, all of the resources needed for resource-aligned testing strategies, such that a region will have a major site where all of the diagnostic tests can be run, but the specimen can be collected at multiple different places and in the comfort of your own home. At Morehouse School of Medicine, we have been doing self-administered testing now with all of our employees on an average of 7 to 10 days. Everybody does their own test. They do it in their car when they do their symptom checker, and they drop it off in a container as they're getting ready to come into the office with their face mask. Haven't done their symptom tracker, and then, keeping their social distance. And we get the results back within 30 hours, okay? And so it is possible to do, but it does require a strategy. And that's what we haven't seen, and that's what we're looking forward to seeing with this new administration.
Then, well, we surely appreciate it. Dr. Rice, Dr. Hilton, thank you so very much for your information. And again, we just want our people to be safe. More of us have died per capita, 1 in 1,000 than anybody else. Folks, don't take the chances. I get it. You want to see family. You want to hug them. You want to kiss them. But the reality is, be safe for Thanksgiving and Christmas. Let us get beyond this pandemic. I come from a huge family. My mom turned 73 on November 30th. And again, would love to see them, but they're staying put. They're not even going to Houston to see my brother and sisters. They've done it several times in the last several months, but everybody is staying put so we can all be safe and be protected. We surely appreciate both of you. Thank you so very much.
Thank you. All right.
Back to our Roland Martin Unfiltered video.
It's time to be smart. When we control our institutions, we win. This is the most important news show on television of any racial background. Y'all put $2, $3, $4, $5, $10, $15, $20, $30 on this and keep this going. What you've done, Roland, since this crisis came out in full bloom. Anybody watching this, tell your friends. Go back and look at the last 2 weeks, especially of Roland Martin Unfiltered. I mean, hell, go back and look at the last 2 days. You've had sitting United States senators today, Klobuchar and Harris. Whatever you can bring to Roland Martin Unfiltered to support it, please do, because this information may literally save your life.
Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.